Well, whether it's a celebrity or somebody maybe you know very well who's had to have a mastectomy, they all face another difficult decision. But a new wave of cancer reconstruction is helping them. Richard Lemus reports.
At age 46, Lynn Curry's life was changed forever when her doctor found a lump in her breast.
My son Alex was 19 years old and my daughter Taylor was 12. I knew in my heart that it was cancer. And I got the diagnosis a few days later.
Her surgeon recommended a mastectomy. After losing her breast, she faced chemotherapy and the decision on how to become whole again.
It was overwhelming to me.
Her choices were limited. An implant wouldn't match her other breast, and another procedure called a tram flap could use her own tissue, but would leave her with weak abdominal muscles.
I really wasn't comfortable with sacrificing the abdominal muscle and, creating a physical deficit to compensate for something that was cosmetic.
Then her surgeon offered her the latest in breast reconstruction, deep inferior epigastric perforator flap, better known as DIEP.
The DIEP flap is the most technically advanced method of reconstructing a woman's breast with her own tissue.
Plastic surgeon Martin Newman says the procedure uses laser-assisted imaging, which allows doctors to select their appropriate tissue to be harvested from the abdominal wall.
It allows us to reconstruct the breast while sparing the abdominal wall muscles and gives the woman a little bit of a tummy tuck.
Tissue can also be harvested from other problem spots.
Other options exist, whether it be the lateral thigh, the saddlebags, or the bottom, the buttock.
Lasers also help with recovery because doctors can make sure tissues are getting proper blood flow.
This is unique with the laser imaging and gives us a good sense of the ability of the blood to flow to and from the tissue that we've transplanted.
The surgery can take up to 10 hours, recovery about 6 weeks, but patients say it's well worth the result.
It was me again, it was natural, just very natural.
Lynn is now cancer-free and back to herself with an added bonus.
After having 2 children and 2 C-sections, I've got a stomach that I never thought I would have. It was the best thing that I could have done.
Well, not everyone is a candidate for this procedure. In fact, some women with medical problems may not be able to tolerate it. In the Plex, Richard Lemus, 7 News.